Got to be a cross table lateral, doesn't it? Portable. They should have put the distance they had, the MA, the KVP, the time. All that should be on there, shouldn't it? That portable sticker is blank. Got the time over here and the date. That helps. No name stamped on it. Can you stamp a gridded cassette?
No.
Not the cassette itself, but you can take the film out at medical center and they still have an old-timey stamper. Everywhere else, no. You have to put a name sticker. One would be better, though, if it were printed off the computer with their name and stick it on there. Okay? So, thank you, Dax. This is what?
Tubing.
It's
Looks like
a
an
tube
NG
going
tube.
down. Okay,
Somebody
it's
said
NG.
it's a
And then there are also wires. That's a wire. But there's the NG tube. See its width?
Mm-hmm.
And then that wire just got crossed. Okay? So, do we have all 7? 1, 2, 3, 4, 5, 6, 7. Okay? 7's body's here, the Promens is here, but it's underexposed, is it not?
Definitely.
If we make that darker, we're going to burn the upper out.
Right.
Right. So, we go back and we shoot it darker and we put both through. Okay? So that we have the upper and we have 7 showing clearly. Okay? So, do you see any problems with the alignment?
It's not curved.
It's not curved, it's straight, so it means a whiplash. Or they've had previous injury. Doesn't look like previous surgery because we'd see some clips or screws. Okay? So these are what? Those spaces?
Oh,
Zygapophyseal, and those little eyeballs are
Pedicles.
pedicles. What is this back here?
The base of the skull.
No, here's the
No,
base of the
that's the
skull.
base.
What's that pointing back there?
The atlas.
It's the posterior arch. You see one? Y'all remember that?
The
Posterior
arch.
arch of C1.
posterior arch. It's
That's
the
the
part that
round
holds
of
the
that.
skull.
It's around on the lateral. We see it sticking out like a spinous process. Let me see if I can find a better lateral. Somebody that's upright. See it?
Oh yeah. You really see.
Theirs is just magnified because it's like the gridded cassette or whatever's over here, so they're not up against it as close.
What is that called?
This is the posterior arch of C1.
Posterior.
Okay? Intervertebral disc spaces. Very good zygapophyseal. Huh? See that? See the anterior pillar and you see the posterior. And you've also got pedicle here, pedicle here, pedicle here. Chin in the way? No.
Mm-mm.
Almost though, huh? What is that bump on the front?
Laryngeal.
No, this
The-
bump right here.
Oh, the
C1, C2 area.
Thyroid cartilage.
Tubercle,
Oh.
anterior tubercle. Okay? Alright, that lateral is pretty good. Let me go ahead and put that whole series up. They did that on a very small film, didn't they? An 8x10.
Mm-hmm.
What's wrong with this one?
Whoa.
Anything?
That's supposed to be a lateral.
Is it? Is it a
Looks like an
lateral
oblique to
No,
me.
or
it's not
is
lateral.
it a
That's an
swimmer's?
oblique.
It's a swimmer's. Okay? That is oblique a little bit. Right here. And then here's another right one. These are just not the same patient, some of them. This one's not right here. They may have been trying to do an oblique there, but they're centered for swimmers. They're centered low. They've got this one with the right marker and that one with the right marker. That's a different patient, isn't it? Smaller vertebra. So that doesn't go with that series. Only these 3 go together. So they were trying to do obliques. Got a left oblique, a right oblique. Where is the problem? R needs to be
It's-
top of ear attachment.
Yeah, it's centered too low.
And they have the IR
Way
centered
too low.
down on the posterior arch of C1, which is back here.
They're cutting off.
Okay? Look at this oblique. Is that almost lateral or almost AP?
It's almost lateral.
Almost lateral. So they've obliqued them about 70 degrees. Okay? Our AP, is that good? There's
Looks
first
good.
rib, isn't it? So we know that's T1. And then that's going to be 7, 6, 5, 4, 3. And then if that would stay up there, that's why I hate
They didn't
this one. I
put
want
the-
to get the other
They
one
didn't
back.
lift the chin.
1
Yeah.
and 2 are up here.
Chin.
But
There's
in
a
the
short
AP,
toy.
you really can't see C1 and C2 anyway.
Yeah, but it still
We
should
can
have
see the
been lifted.
bends
a
right
little.
there, but the chin, the
Needs to be
mandible is
lifted.
down in the cervical. We're supposed to see
You line up
3
the mandible and the base of the
Mhm.
skull.
or go back to the AML,
Yeah.
and that'll lift the chin out of the way, okay? So that we can see this area well. Now this oblique, same thing. They have them almost lateral, okay? And they're centered way too low, aren't they?
Mm-hmm.
They're centered way above. It should be an inch above the external arch herniatus, right?
Right.
So they're only off about
Another
3/4 to a half inch. Okay? But look at the vertebral bodies. Are they more AP than turning sideways looking like a lateral?
inch.
That tells me, well,
More PA.
Mm-mm.
when you look at it though, that patient's vertebral bodies aren't rotated enough. So that's under rotation. Because they look more AP. They look stretched out, the bodies. When they're lateral, too much, rotated too much, they look almost lateral, the vertebral bodies. Okay? They look almost AP here because here's a pedicle, and there's a little piece of a pedicle. They didn't turn them enough. They didn't rotate them enough.
Didn't turn the head enough?
The shoulders.
Shoulder?
And then the head back. Okay? Because the shoulders have to match the
It's
hips.
supposed to be at a 45.
It's supposed to be at a 45, and that's probably about 20 degrees.
They got dentures in?
They do, a
Like a
bridge.
zipper.
See the bridge?
Bridge.
Got a bridge.
Looks like a zipper.
Yeah.
Got a bridge.
Keep your mouth shut, boy.
So if that's a non-removable one, not anything we can do about it. But if it was removable, we should have removed it, right?
Mm-hmm.
What is that
Okay.
really getting in the way of, though?
It
Well,
can
that shot.
obscure
Oh, yeah, other ones.
on the odontoid. Okay, that's where we'd want stuff out. But they don't obliques on the table. Did you know you could do obliques on the table? And I'm flipping it that way because they got a right marker on it. Ooh, a very bad odontoid.
Huh?
They have no teeth. They have
Yeah.
dentures that they had to remove.
Yeah, but
There's an elevation.
That
Yeah,
is
looks nice.
lateral. This is bad surgery.
They didn't pass it.
No, they didn't. Okay, and looking at the lateral over here, we know one thing. They've centered way too high on that one, right?
yeah.
So that needs to be about right here, the top of the film, or IR. See how I know they have dentures? There's no teeth there. Okay? Except that one down in the gums. Okay? 1, 2, 3, 4, 5.
Shoulders
That's all
aren't
they got.
down far enough.
Shoulders aren't down far enough. Trauma, though.
Oh.
So they went back and they said, well, I want it darker, too. But they weren't smart enough to move
They
it
didn't
down.
move
any
it
did they?
down.
Now, if you're going to go repeat it, aren't you going to correct everything you saw the first time?
Yeah.
They didn't.
So they had to repeat it
The
again.
name blocker was right there in it. So here we've got 1, 2, 3, 4, 5, 6.
And
6
the
showed
blocker.
up when it was darker. The blocker's in 7.
Yeah.
So they can lower this. Hopefully they realize that.
Nope.
And they went down a little bit, but still not where they needed to be.
But then they still changed their
Okay.
exposure factor.
And what do we say about the blocker? Blocker's bottom on C-spine, top on T-spine. T&T, top T-spine, bottom C-spine. Okay? So we've got 1, 2, 3, 4, 5, 6, 7 right there. But still underexposed, isn't it?
Mm-hmm.
So what they need to do is the swimmers, isn't it? Because they burned all that out
Yeah.
by going up and doubling their density. So they need the swimmers. And that would have helped them rather than re-exposing the patient 3 times.
They could have done it twice.
They could have done it twice and be done with it. Okay? We can see zygapophyseal right there. Can you see it?
Yeah.
If you can't see it, come here.
Yeah.
Right here.
Space right
See it slanted down right there?
I see it.
In here? Okay, those are zygohypophyseal. Now, and looking at the AP, do we see the odontoid on there? Yeah.
Yeah.
Right there through the
Good.
foramen magnum. So what does that tell us? They're lined up on the mentomeatal. They've got their head way back instead of AML. They
Yeah.
use mentomeatal for their AP. They got their lines messed up. Okay? So, we shouldn't see their head back that far because then it puts the base of the skull where? Down in our
T1,
cervical
C1,
vertebra, and we're trying to do this to see them. Okay? So there's our first rib right here. It's coming up to T1. Okay? So we know
But
that
their
7,
centering's
6,
all right.
5, 4, 3, 2 is in here, and then 1.
The
So-
centering's all right. The head's
Their
just-
head is shifted over. If they're in a collar, I can't move them. So I'm not going to. I'm going to shoot them the way they're laying there. Once the neck has been cleared on that lateral, then I can line them up. And I can take the front of the collar off. Okay?
They're not in a collar though, right?
No, they're not, but it said
Because
trauma.
head. Oh.
But they do not have the head in alignment with the body, do they? Mid-sagittal plane.
If they're not in a collar and there's still trauma, we still don't want to move their
If they're
head.
trauma, they're in a collar. Okay? Until cleared.
Yeah.
When the radiologist clears them, we can take it off of them and we can do our series.
And
But then when they walk, they get up from the table and they're going to walk to the chessboard, you're going to do those uprights next for him, put the collar on them to get up there. And then I let them sit on a stool because when you've had trauma like that, it's a shock. And you could drop out after being laying down, then standing up, and then somebody pulling on your neck. You don't ever want to pull, but if somebody just turned your head like that and you're already stiff and hurting and nerves are inflamed, they could pass out on you. So I sit them down on a stool. And when you sit them on a stool, don't you have 4 legs on that stool?
Most
Make
of the
sure it's
time.
square when you sit them down. And that way you just roll around for 45 for those obliques to that leg. And put a foot on each side of it on the rung. Okay? They told them not to breathe, move, or swallow. How do I know that?
'cause they have
Trachea
air
is
in
full of
trachea.
air.
Mm-hmm.
Very good. Okay? Do you know that those are spinous processes? Staring at you? Okay.
Transverse is in the back and spinous
Transverse
is in
are on the
front.
side.
Oh, the spinous,
Spinous is in the
across
back.
Spinous is in the back, and we see it burning through. Okay?
Oh, that's why. Okay, I
We
what
see
you're
it where
saying.
it attaches to the body.
Like you see the pedicles on the lateral.
Ugly, right?
Ugly.
Got the chin down in, mandibles down in it. Base of skull is right there. So what did they do? The mouth
Open
is
their
only
mouth
open
and open it.
about that much. And their head's just straight.
They didn't.
They did not use AML.
AML.
They didn't open the mouth as wide as they could. So they need to lift the head up, don't they? Get the chin out of the way, open the mouth. Technique, very washed out, isn't it? Not contrasty. So they're high, their density
Seems too high.
is probably normal, and they're using a normal technique, but they've jacked up their KVP so that it's penetrating it quite a bit to burn it out to see, and it's making it look a lot denser and no contrast. It's washing it out, graying it out.
Burning up the top.
Mm-hmm. And the thyroid. Don't forget about it. It's radiosensitive. Obliques on the table are hard to do. These are almost true AP. Look. See how that body, what I've been telling you, see a pedicle here and a pedicle here? It's almost AP instead of being oblique. It looks almost AP instead of lateral. Lateral's smooth in the vertebral body. You can see it from the side already, and you see that spinous process starting to come out in the back here. Where this one, it looks like there's a piece here and there's something around there. Pedicle, pedicle, and it looks square. Okay? This is under-rotated. See, compared to how the body looks laterally?
Yeah.
Yeah.
See where the pedicle is here? The pedicles are like back in here. On the lateral, we can't see them. That's under-rotated. This is lateral. Okay?
And that's an LPO.
That is, they're probably on the table and they're LPO. Faces that way, and they've rolled them up on a 45
So
degree
they're
angle
under rotated. So they're almost
So what
18.
they did was, I think, they just went and shot them.
Oh,
And didn't roll them up on a 45-degree sponge too and turn
Just
them in.
turn their head.
They just turned their head and thought that was going to do it. Didn't. Same thing on this one. Also centering way too high, aren't they?
Mm-hmm.
Why those joints aren't that open?
Yes.
earrings, necklace,
Necklace.
bra.
They must have been using a technique for metal because
They got lots of
they
metal.
burned her up.
Hey,
Eyes,
no.
thyroid, skull, everything.
That was an 02.
Ooh, that looks like it hurt.
Yes, it does.
How did their neck do?
Now this is a limited study over here that they did. But this one, her earrings, ER left them on. ER is supposed to remove all jewelry, all obstacles in our way before we ever get them, which means cutting the top off if there are buttons in it. Supposed to have cut their jeans off so we don't have that problem with the pelvis or abdominal area. They're supposed to take out earrings and all necklaces, but they don't.
No.
And why do they use such a big IR?
Well, they put them in the chessboard, and the chessboard in some places used to, it wouldn't adjust to whatever size you put in there. Like ours down there, it only takes a 14 by 17 or an 11 by 14. Well, somebody was scared of doing this trauma, and they put a 14 by 17 in there, crosswise like that. Rolled the stretcher up there and shot them like that. Okay?
And burned everything up.
It looks like,
They have to be in a collar if that earring is staying up
Yeah.
like that.
yeah, one earring's here, one's there on the other ear, and there's the necklace.
Well, if
And
they're in
there's
a
a
collar,
tube down her, and there's wires on her.
if they're in a collar and you can't reach to get that stuff off, then you
You
can't
have
get
to
it out.
tell them and caution to hold very still. Someone holds the head right here, you unstrap it, and you pull the necklace
But
around,
it should be
unclip
off
it,
already.
and take the earrings out. But it's ER's responsibility to take it off, and they don't.
But we can take it off.
We
just
take
be
it off,
careful.
but you better put it in something that will go back to that patient's room with them. Because if you put it in a cup, you put it over there on the counter, someone will come through
Thrown
the room and
away.
throw it away. I've had it happen. Okay? So be very careful with that. A lot of times I take it off and put it in their hand and tell them to hold it. Again, that's where they went back and they shot it again.
And it's still dark.
Okay? They probably were using the AEC and they were trying to center down on the shoulder to make 7
They missed
show up,
the
so it
cells.
burned everything here. Okay? Up. Or they jumped their density up on it, thinking that would help. Now, that person has extreme curvature in their C-spine, don't they?
Yes.
Yeah.
It looks
Is there
like
a
it
neck
hurts.
with-
Here, they're intervertebral disc spaces, but they're very narrow, aren't they? They're like this.
Could that be from osteoporosis?
It could be.
In the neck?
It could. Some people, Dr. Sykes at our lab is named for, he ended up with degenerative disc disease and osteoarthritis, and his little head went over this way, and he was like this. And they make like a collar that'll help hold your head once it gets to an extreme curvature. But their chin's in the way, so if you're like this and we ask you to raise your chin, can you? You're probably
It's
frozen there.
maxed out.
Okay?
It's
There's
maxed
not
out
much we
all
can do, but
over.
we can see the posterior arch of C1 very well, can't we?
Yeah.
We can see zygapophyseal, but look, that one's closed, that one's open, that one's very narrow. Are we going to correct that? No, we can't. It's the body.
That's as good as it's
That's
going
as
to
good
get.
as it's going to get. So 7, 6, 5, 4, 3, 2.
They have all
Unless
their
you-
teeth, so they're probably not that old.
You'd have to.
Look at their neck.
I don't
too.
know.
Well, some
My
people,
aunt's 88.
yeah,
She's
some
got
people
all her
don't lose all their
Really?
My
teeth.
grandma, she was 100, had every one of hers.
Really?
Yeah, all her original teeth.
In a bag
I
or?
love my teeth. I know you can have them. Where are they?
Oh,
I just make jokes.
That's messed up.
oh, okay.
I carry them on a necklace. See?
Bad. Now this is an example of centering to flow for the AP, right? And what is that line right there and right there?
Collar?
No? No?
How you?
That.
Fat. Okay. They've got a short
A
little neck
fold.
and they've got a fat fold, wrinkles right here. So when they had them lean back, their little wrinkled up skin right there left a little line across there. Okay? Right across here and right across here. And it could be in the back of the neck when you go back, that little pooch. Okay? They had a big one. This AP, they've got fillings. See those mastoid air cells on each side? Now, what did they not do?
They didn't lie.
They didn't lift the chin, so we're covering up. Good anatomy there. Otherwise, technique,
Pretty good.
You can even see
you know,
through
you
it.
can
see through it.
Zygapophyseal burn through, but you got teeth and lines there. So the radiologist can't read it. If they'd lifted their chin, they probably would have seen the odontoid.
Perfect.
Okay? That's a patient that's able to do it too. Their joint spaces are even. They look young. Their bone density looks good. They just didn't do it.
If they would position correctly, they would
Not
not.
lined up.
As far as look at the difference.
So old film.
They didn't chemically wash everything off there. That's where developer ends up being left on it. So as it ages, it turns yellow. So your processor wasn't running correctly.
Is that a dichroic stain?
It could be.
Is that a broke jaw?
You win that one.
All right.
Okay,
like
looking at this one, we see all the anatomy we need to see, don't we? Other than we still have that mandible down,
Jaws.
okay?
You figured they did.
So you figure that's a common error now that you've seen it enough, don't you?
Yeah.
Okay? Those are all spinous processes. That's intervertebral disc space. Okay? And this one, you like the technique on it? This is what I like. I like contrast, like black, white detail. Okay? Love that one.
How come there? That looks magnified. Well, I guess it would be if it's AP. The clavicle looking magnified.
Yeah, they look
Yep.
really big.
But look what they didn't do.
What is that?
What did they not do? They angled 15 degrees and didn't line their eye. So they were just lucky they got it all on there. Okay? But that's what they didn't do. Bring this one down. What didn't they do?
Decant.
Trans detention. See how it's cut here? Collimation's cut. They didn't trans detent. And again, we don't look like we've got enough wash there, do we? Okay? What about this one?
Their head's tilted to the
AML's
side.
not lifted, lined up. The head is tilted. Okay? And it didn't wash very well either, did it?
Ew.
Oh.
The mouth is closed.
What were
What
they
is that?
Supposed to be
attempting?
like a
What were they
just
trying
left their
to
head
do?
straight.
That person needs to
Oh.
go back to first semester.
They did this for their oblique. Okay? If you're AP and they wanted to do oblique on the table, and instead of rolling them up and doing that, they went. That's it.
And
all they did.
Are too low.
That's all they did. And they centered
Yeah, that's.
up high and got a lot of the eyes.
And
Okay?
the head is down, so they got more.
Right. Right. Now this one they collimated. That was good.
Underexposed.
But see those little fat lines in the back? Now you can see them well. It's way underexposed. Need a double density there, which means they probably left it either on the outside cells or something instead of on the center cell.
So you could go a +2 density on that one.
You could go to the center cell and double the mass that it shot. Anytime I start with AEC and I have a problem with technique, I look at what it shot and I go to manual that I can control. But you got to have that starting point from the AEC if you don't work there every day and know what it normally shoots on that size person. But always look at that and then you know where to go when your film drops out. This one, what they do, they're trying to do an odontoid. We know that the jaw is out of socket there. Okay? So we don't have much control over them opening their mouth, do we?
No.
You won't say, open your mouth as wide as you can to somebody like that, will you?
Let me pop it back in for you.
Okay?
Let me
They
shove this
have-
over.
Looks like a little tilt on that head, too.
No, it matches up with the spine. It's the jaw that's over to the
Yeah,
side.
the
I
jaw's
think you're
just
right.
messed up.
Yeah.
I think you're right. But they've got them open and pretty wide. There's teeth and there's teeth, don't they?
Yeah.
Right, close
Could you do
it.
that if
probably
it
with
was
some
popped
morphine.
I
out?
wouldn't do
You
that.
probably can't close it.
That's
if it's
right.
locked.
You probably can't close it. It probably popped out and down, and they went
Golly, I bet that
and
hurt.
came in like
You know
that.
it?
That hurts.
I bet that's.
Lockjaw?
It hurts
Oh.
worse whenever you pop it back in.
Oh.
All right, this one didn't wash very well either, but their centering is good, isn't it?
Very good.
And we've got first rib coming in right there. Okay, so we count.
5, 6, 7.
Okay, so that's T1 right there. We've got good spinous processes,
That's good, except for
good
the
centering, the processor, and the density. It's a really good one. That's a good example.
No.
Occipitus, base of skull.
Yeah.
Base of the skull. So they have that head
Got their
way
head way
up there,
back.
don't they? In a fuchs almost. Okay? This one is the opposite.
Whoa.
They went for it. They went pointing.
Down through the mouth.
Yeah, because
Okay,
there
that-
goes the teeth.
Tilt
You
your
know,
head
teeth
back.
are lined
Then
up.
go
Here's
straight
the
down.
mandible.
Yeah.
There's the teeth. They didn't even know what they were doing, did they?
Shooting through the nose.
What were they trying to
Maybe
do?
they were trying to do a odontoid, but they angled down.
Well, it looks like
I
they
don't
angled
know.
quite a bit the wrong direction and
Yeah.
the chin's down. Okay? Look at this one. Base of skull is here. It's in the odontoid area and chin is down. So do you think their mouth is open at all?
Mm-mm.
No.
Teeth are
No.
together.
Look,
Oh.
teeth are together.
Mhm.
So they just have their mouth closed. Like that and shut it. Now this one, what were they doing?
Oh.
That's a good
I
question.
don't know.
That's a
T and T spine
T-spine
together.
on a 8x10.
It's supposed to be upper T, lower C.
I don't think
Upper
that's
T, lower
T.
C.
And
They ain't got no C.
they got the blocker in the C, and they overexposed the heck out of it, did they? A lot of
Yeah.
times when you do an APT, sometimes you slice a little bit of C7, so we'll go back and do a 10 by 12 from here to here, just so we get optimal technique for the C and the upper T. They didn't.
I said, man, that's beautiful. Let's just keep it.
All of these are throwaway films that we've gotten from different facilities.
Odontoid or
Now, when you
something.
wanted to print off, they can print it without any information on it.
And they'll print them for us when it's something interesting. What happened here?
They not centered in the hips.
So what would you do to correct it?
Were they deep?
come over to the?
Yeah,
Maybe
that's
that's
a copy.
to the
See,
left.
it's a 9 by 9 that they copied on copy film. Remember, copy film has 2 notches at the top there.
Yeah.
That's a
to the
9 by
left
9.
about
Oh,
3/4 of an inch.
Move over to the left
And the
this
head's a
way to
little
be
bit
in the
tilted.
center. Straighten the head up. Okay. Here are the zygapophyseal, and you have a little teeth in them. We've got a little room above that, so doesn't that tell you I need to open their mouth wider? Not tilt their head backward or forward, but open their mouth wider, because those teeth need to go up a little more, and these need to come down a little more to open that zygapophyseal. Right here on the other side of the odontoid, this right here, that's the lateral mass.
I can't see you.
Come here.
Well, I can see. I
Right
just
here.
can't see where you're pointing.
Right
okay.
here. Lateral mass. Then there is a process coming out here. That's the transverse process. Okay? And there's your dens or odontoid. Now see those wisdom teeth. That's a young person.
Right there.
Overexposure.
Something in there.
Lateral of some
Be
sort.
underexposure.
With their trachea.
Ah,
What is that? One big vertebra?
that's what it
One
looks
big
like.
body?
Man.
What they do, fuse
It
the neck?
is. They fused it. It's a fusion from C3, 4, 5, and 6.
Rheumatoid arthritis?
They
And
just
then it
went
looks like
in
it's wrong.
and they probably had either collapsed disc and they took bone
Just
and
grafted
fused
it
it.
in?
Or either
Mhm.
degenerated.
Fused it in here or degenerated. And they took bone and grafted it in there and fused that whole area. So they don't have much mobility, do they?
Mm-mm.
Oh, I know someone. He can't turn his neck like
They're
that.
just like they're in a
Right.
neck collar, really.
Yeah. What do you notice? The earring distracted you, didn't it?
Yes, it did.
What else is wrong?
Ew, they kind of,
Where's that coming down?
Hangman fracture.
yeah, where's the,
Look.
Oh,
Yeah.
she's dead.
Man.
Okay.
Dang.
See how jewelry can be distracting?
Mm-hmm.
Definitely.
Broke the dens off.
Yep, it did. It's right there.
Broke what off?
Broke the dens
Dents
off.
off.
Oh,
That one's way overexposed.
sure is.
There's no odontoid. What's the problem with that one?
It's
Where's the
tilted.
odontoid?
They have. It's gold now.
Yeah.
They
Uh-huh.
have a cap, and it's gold. It's metal.
Oh, on the
Teeth are in the
odontoid?
way.
Their head's
Can't
not
see
tilted
it.
back enough.
Okay, so we need to align their head. It's tilted with the rest of the spine. Straighten it up. Zygapophyseal show up pretty good, but we're going to have to do a fuchs for that no matter what to get that gold tooth out of the way. All these people
So
wearing
it's
grills and all
odontoid?
that stuff now,
Mm-hmm.
they're going to give you, you know what, when you try to do an odontoid. Because that'll get in the way. Because it extends the length of the tooth and the metal covers. So if they're removable, they can take it out. If they're not, you're going to have to work with them and try and get it. Now that is a lateral.
Shoulders
You think?
are not
Is it?
dropped.
Are they true lateral?
No.
No,
No.
they're rotated.
See, they're rotated.
No.
Mm-hmm.
It's almost going lateral though, isn't it? So it probably was an oblique
If it was lateral,
that
you'd see
was
the spinous
oblique
process,
too
wouldn't you?
much, right? Because the bodies look almost lateral. So this one's too much obliquity. Now that one, what do you think about it?
Looks like they're
Looks like
got a
they
curve in it.
don't have any discs left.
They don't have many disc spaces. They have a lot of osteoarthritis. See how that's sealed together there just on its own? It's got extra calcium right there. Technique-wise, needs to be darkened, doesn't it? There's soft tissue of the neck. Cross-table lateral. You see the problem?
Ooh. There is no C7 or
Man.
There's 1, 2, 3, 4
C5
Five.
is gone.
is subluxated. It's back and down and crushed.
That's
There's
bad.
6 and 7. The cord's back
It's
here.
definitely not
Probably
good.
snapped it.
Yep.
Okay?
If they're still alive, they can't move.
Right.
Paralyzed
That-
from the neck down.
Looks uncomfortable.
So be sure that you don't move their heads. Because you will then, if you turn it,
Pinch the spinal cord.
shear
They'll
that
just be
completely
gone.
off if it was just partially sheared.
What's up with the?
Really minute too, isn't it?
What
You
would
don't
they
really
do for
notice
something? What did they do for something like that?
Pressure
Like a
dens.
fractured
we
den.
hope that
Put
it
'em in a collar?
doesn't. We put them in a collar to stabilize them. We hope that it doesn't shift and that it will calcify. And they have to sleep either in a halo that screws in right here, here, and here, and it keeps them just straight and has metal on each side. That's
Yeah,
what
I've
they
seen people
usually
like
do.
that before.
Like after having cervical surgery, they won't go in and pin it right then. They want it to recalcify.
Oh, okay.
There's 7. Nipped it right
True
there
lateral.
though. Does that go to court? Nope, all 7 aren't there. Seven's there.
Yep.
Got reversal lordosis, don't we?
Mm-hmm.
Almost have those gonian in there, don't we?
Mm-hmm.
So they didn't lift the chin out of the way. This is a good example of arthritis. See that calcium buildup right there? See the crushed vertebra
Oh.
right there and right there?
Man.
Another reversal on lordosis.
They do.
Small person, child, 7, 6, 5, 4, 3, 2, 1's here. So that's 7. That's T1. Okay?
They do kyphoplasty on cervical also.
I've not heard of them doing that.
Like if somebody were to have a compression.
They usually go in and fuse.
Yeah.
Sometimes they put the cage. You know, but usually they reserve the cages for the L spines.
Yeah.
Y'all seen cages at Nac Medical? They do those quite a bit there. Okay, let's look at some T-spines. Yeah.
I saw one of those in a picture where their pelvis was shooting out the side.
Okay. Poor thing, look at that. Now what does that do? It puts pressure on the heart, on the diaphragm, on the
Golly.
abdominal content, and then around.
Everything's in a bone.
So
gonna be a
they're
hard
like
life.
this.
Oh, that's
I'm like, it's definitely one shorter than the other.
That's a baby.
that's a younger person.
Young
yeah.
person.
Yeah, it
Usually
is.
we find this in girls around 13, 14, puberty. 12, 13, 14, it starts to show up in them.
Is that reversible or not?
They can take them to surgery and put bars in and straighten them rods.
Put
then if
rods
the
in
rods
transverse
bother them,
processing.
Then they can take them out years later. But there have been people, I know a couple that had them in high school and she ended up having a couple of children. She still has her rods in her spine.
Does polio cause kyphosis or?
Polio, lordosis, yeah, more
Because I know
so.
somebody has polio and he walks like that.
Yeah,
That's mostly with the
And-
legs, isn't it?
it is with the legs, but it can cause
And his
spine
back.
shift because of one foot being shorter than the other and causes a lot of pelvis problems.
Yeah.
But this is just T-spine, lateral, okay? So if that's 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, there's 1. Okay? That's the technique we want on our T-spine. Here's our AP. See how the upper looks good and the lower? Other than being off mid-sagittal plane, what happened there? They put their shoulders in alignment, didn't shift their hips over. So we look for T1, the first rib there. So we know that's T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay? That's a little bit of a rib trying to come off right there, but not like that floating when we're seeing, right? That one didn't form all the way. Plus they're turned a little bit because look at the spinous process here, here, and here. Shouldn't those be in the center?
Yeah.
Right.
And they're not.
They're
It's turned.
rotating.
They're
Their hips are
rotating.
rotating.
Okay, so that shows you that and demonstrates it on there. They need to line their hips up and have them true AP.
Lateral? I don't think
It's
so.
supposed to have been a lateral. That's supposed to be an AP. They centered too far anterior on the lateral, right? They weren't on the spine. So if they had the cell right here, it took up on the lungs. So it's
Right.
way underexposed.
Big time.
Okay? Said it was 25 MA, 4 seconds, 84 kVp. Needs twice the mass. Now this one, what's going on with it? They got a little curvature in the T-spine, don't they?
Mm-hmm.
And that causes, instead of that to be true AP,
It's more of an open.
it causes some problems in the lumbar too. So they've got slight scoliosis.
That line going down.
Okay. What line, Dax? This?
Yeah.
That's the aorta.
Nothing.
Got that one?
Is that just the edge of the spine?
It's the edge of the spine. Yeah. Okay. Lateral. That's just costotransverse. Okay, do you remember what this is, where the rib lays down on the transverse process? Costotransverse, where the rib head meets the vertebral body. Costovertebral. Okay? So we look at this and we say, all right, where's the first rib? Right there. So that's T1, or is that the first rib?
Looks like
That's the first rib if you
Yep.
cut T1.
Cut off.
So T1's been cut, so that's got to be 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That's 12, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. But that rib is sliced the top of it. I mean the rib, the film. Because there's the rib coming right there to it.
Sitting a little too low.
Okay, so they centered a little too low. And they didn't line the shoulders and hips up, did they? Mm-mm.
No.
Look at this one. Is it pretty good? See those little eyes? Those are pedicles. Center point, spinous processes. Ribs coming in. Posterior ribs are these ribs. Anterior ribs are these ribs. Okay? Now, if you look at that person, are their clavicles even there? Sternoclavicular joints? Here's one, here's the other. So they are rotated a little bit, aren't they?
Yep.
Okay. Look at the lateral. Do you like that?
Light.
It's underexposed. What's wrong with it?
Does it got movement, rotation?
So yeah, it's rotation.
It's got rotation, and it's hung upside down. Nobody said a word, and it's a phantom. Okay? See, that's one of our old Alderson phantoms. It is rotated a little bit. See those ribs? Here are the vertebral bodies. Okay, that's the intervertebral disc space. And this little ear shape is the intervertebral foramina. Okay? Now, see we don't have arms?
Yeah.
That's how we know it's a phantom too. Alright.
Collapsed lung of a child.
Okay. That lung is just obliterated, and the other one, you've got a little bit of it right here, and the other one's tried to expand.
Thursday,
Uh-huh.
17, had a flu with
Ooh, spontaneous coughing did it? Spontaneous pneumo. Anytime the flu starts, we find that, especially in boys, 16 to 20. Nope, no swimmers with this one. Okay, we're moving on to swimmers. Underwire bra. There are the clips, there are the wires. Okay? Sometimes you tell them to remove them and they don't, do they?
D10. Rotation.
Let me go get my book and I'll tell you what I've got written in there for you.